Have you ever wondered about the current state of stem cell therapy for type 1 diabetes? Before we delve into this exciting field of scientific inquiry, let's first get acquainted with the broader context of diabetes. Diabetes is a chronic disease that affects millions of people worldwide. It comes in two main forms, type 1 and type 2 diabetes. Type 1 diabetes, as we will discuss in detail later, is an autoimmune disease that attacks the insulin-producing cells in the pancreas. Type 2, on the other hand, typically develops later in life due to lifestyle factors and results in the body becoming resistant to insulin. There's also a form of diabetes that affects pregnant women known as gestational diabetes, and another rare form known as monogenic diabetes. Each of these types of diabetes has its own unique causes and treatments. Diabetes is far from a benign condition. In fact, it's one of the top 10 leading causes of death worldwide. It can lead to a host of health complications including heart disease, stroke, kidney failure, blindness, and lower limb amputation. The stakes in diabetes research and treatment are high, particularly when it comes to type 1 diabetes. It's a question that draws us into the realm of scientific intrigue, where biology and medicine intertwine to hold the promise of groundbreaking treatments. Stem cell therapy, a fascinating field of study, harnesses the power of biology to fight disease. It's a science that is still unfolding, yet it holds the potential to revolutionize how we approach a wide spectrum of medical conditions, including type 1 diabetes. So, what is type 1 diabetes? It's an autoimmune disease that attacks the insulin-producing cells in the pancreas. This attack leaves the body unable to produce insulin, a hormone vital to regulating the sugar in our bloodstream. Without it, the body's cells cannot absorb sugar or glucose from the blood. This can lead to dangerously high blood sugar levels, a condition known as hyperglycemia. The traditional treatments for type 1 diabetes have been a daily regimen of injections or an insulin pump. These treatments don't cure the disease, but they do help manage the symptoms. However, they can be inconvenient and come with their own set of risks, including the risk of hypoglycemia or low blood sugar if too much insulin is administered. But what if there was a way to actually cure type 1 diabetes? That's where the promise of stem cell therapy comes in. Imagine harnessing the body's own cells to repair the damage caused by the disease, effectively curing it. This is the potential of stem cell therapy, a field of study that is pushing the boundaries of what we once thought was possible in medicine. Now, let's delve into the fascinating history of stem cells, shall we? Our story begins in the mid-20th century, when scientists first identified stem cells. In the grand tapestry of scientific discovery, the 1960s stand out as a time of profound breakthroughs. Among these was the discovery of stem cells by two Canadian scientists, Dr. Ernest McCulloch and Dr. James Till. This pair of researchers, working at the Ontario Cancer Institute, made the landmark discovery while studying the effects of radiation on bone marrow. Stem cells, to put it simply, are the body's raw materials. They are the cells from which all other cells with specialized functions are generated. This process, known as differentiation, allows a stem cell to morph into a multitude of different cell types, from blood cells to brain cells and everything in between. But what truly sets stem cells apart is their ability to divide and create more stem cells. This self-renewal capability makes them a potentially inexhaustible source of replenishment for damaged tissues or organs. It's akin to having a built-in repair system for the body. Dr. McCulloch and Dr. Till's discovery was nothing short of revolutionary. For the first time, science had identified a cell type that could potentially be harnessed to treat a myriad of diseases. From neurodegenerative disorders like Parkinson's disease to cardiovascular conditions and even cancer, the possibilities seemed endless. The discovery of stem cells also opened up a new frontier in regenerative medicine. Imagine being able to grow a new heart from a patient's own cells, or to heal a spinal cord injury by replacing damaged cells with healthy ones. These were the dreams that the discovery of stem cells brought tantalizingly within reach. To say that the discovery of stem cells was a turning point in medical science would be an understatement. It was more like the dawn of a new era, an era in which the body's own cells could be used to heal, regenerate, and potentially cure. This discovery marked the beginning of a new era in medical science. The discovery of stem cells propelled science into a new frontier of possibilities. As we journey forward, let's take time to recognize the remarkable advancements in stem cell research that have brought us to this point. In the mid-20th century, Dr. Edward Donald Thomas made significant strides in stem cell research. His pioneering work in bone marrow transplantation, a procedure involving the transfer of stem cells, won him the Nobel Prize in Physiology or Medicine in 1990. It was a testament to his groundbreaking work and laid the foundation for future explorations in the field of stem cell research. Fast forward to the early 21st century, and another towering figure emerged in the arena of stem cell research. Dr. Shinya Yamanaka, a Japanese stem cell researcher, made a remarkable breakthrough. He discovered a way to reprogram mature cells to become pluripotent, a state where they can develop into any cell type in the body. This led to the development of induced pluripotent stem cells, or iPSCs, a major milestone in stem cell research. For his transformative work, Dr. Yamanaka was awarded the Nobel Prize in Physiology or Medicine in 2012. The development of iPSCs has been a game changer. These cells have revolutionized the landscape of regenerative medicine, providing a potential source of cells for disease modeling, drug testing, and most importantly, cell replacement therapy. One shining example of this is the successful treatment of type 1 diabetes with iPSCs by Vertex Pharmaceuticals. By using a patient's own cells, the need for a donor match is eliminated, making the treatment more accessible and less risky. But it's not just type 1 diabetes that's seeing the benefits of iPSC therapy. From rare genetic blood disorders to heart failure, multiple sclerosis, cancer, and even HIV, the applications are vast and varied. The potential of iPSCs in regenerative medicine is immense. With the advent of these advancements, the potential for stem cell therapy in treating type 1 diabetes began to emerge. But the journey of scientific discovery is far from over. As we delve deeper into the world of stem cells, who knows what transformative discoveries await us in the future? Fast forward to the present day, where stem cell therapy holds promise for treating type 1 diabetes. As we delve into the world of regenerative medicine, the potential of stem cell therapy for managing this chronic condition becomes increasingly apparent. Consider the success of Vertex Pharmaceuticals' VX-880, for instance. This innovative treatment utilizes induced pluripotent stem cells, or iPSCs, marking a significant stride in the realm of stem cell therapy. This technology has the potential to redefine our approach to treating type 1 diabetes, a disease that currently affects millions worldwide. The beauty of iPSC therapy lies in its use of the patient's own cells. By transforming adult cells into stem cells, these can then be reprogrammed to act as insulin-producing cells. This process eliminates the need for a donor match, which has historically been a significant hurdle in the field of regenerative medicine. With iPSC therapy, we're essentially using the body's own materials to fight disease, paving the way for personalized medicine. But let's take a moment to consider the broader implications of this therapy. As we've discussed, type 1 diabetes arises from the body's immune system mistakenly attacking its insulin-producing cells. By creating new insulin-producing cells from a patient's own tissues, we're effectively giving the body the tools to replenish what was lost to the disease. This approach tackles the root cause of type 1 diabetes, rather than merely managing its symptoms. Yet, as with any medical breakthrough, iPSC therapy is not without its challenges. The manufacturing process of these cells remains complex and costly, and there is still the ever-present risk of toxicity-related events. However, the progress made thus far is promising, and research continues to forge ahead in the quest to make this therapy widely accessible. While promising, the journey of stem cell therapy for type 1 diabetes is not without challenges. But as we continue to navigate this path, the potential rewards for patients around the world are simply too great to ignore. The future of medicine may very well lie in our own cells. Despite the exciting advancements, stem cell therapy faces certain hurdles. One of the key challenges is the complexity of the manufacturing process. Stem cells, particularly induced pluripotent stem cells, or iPSCs, require meticulous handling and precise conditions to ensure they develop into the desired cell type. Any misstep in this process can lead to undesired outcomes, including the risk of toxicity-related events. Working with stem cells is like conducting a finely tuned orchestra. Each cell must play its part at exactly the right time and in the right way for the therapy to be successful. This precision is challenging to achieve, but researchers are continually refining their techniques to improve the reliability and safety of stem cell therapies. On top of this, the regulatory landscape for stem cell therapies presents its own set of challenges. However, the Food and Drug Administration, or FDA, is reorganizing its Office of Tissues and Advanced Therapies to expedite approvals. This restructuring aims to streamline the process, making it easier for promising therapies to reach those who need them most. Looking ahead, the future of stem cell therapy is bright. The global cell and gene therapy market is projected to reach a staggering $10.8 million by 2027, and this growth is fueled by significant investment from private equity and venture capital. These investments are not about monetary gain. They represent a belief in the potential of stem cell therapy to revolutionize medicine. With continued advancements, we could see treatments for conditions that are currently untreatable and more personalized therapies that use a patient's own cells. While we still have a long way to go, the future of stem cell therapy for type 1 diabetes looks promising. If you found this video informative and helpful, please consider subscribing to our channel and sharing this video with others. Your support helps us continue to bring you the latest in medical advancements. Thank you for watching. We hope you found this video informative and enlightening. Let's quickly recap what we've learned. We discussed the intrigue of stem cell therapy, its discovery, and the advancements made in stem cell research. We delved into its potential in treating type 1 diabetes and tackled the challenges that lie ahead. This therapy, still in its infancy, has the potential to revolutionize medicine and offer new hope for those living with type 1 diabetes. But for this potential to be realized, continued research and advancements are needed. We encourage you to share this video with others who might be interested. By doing so, you're helping to raise awareness about this promising field of research. If you're new here or haven't already done so, please consider subscribing to our channel. We regularly upload videos on medical advancements, and your support will help us continue to bring you the latest information. Thank you for watching. Don't forget to subscribe and share this video. Together we can spread the word about the exciting potential of stem cell therapy for type 1 diabetes.